Alright, today we are going to take a look at flaccid dysarthria and discuss some of the different symptoms and behavioral treatment approaches that you can implement in therapy sessions to target some of the most commonly disordered speech characteristics associated with this disorder. As most of us know, flaccid dysarthria is caused by impairments or damage to motor neurons of the peripheral nervous system, also known as lower motor neuron damage. The most common description of flaccid dysarthria usually includes a noted weakness in the speech or respiratory musculature of a patient. To target some specific areas of the deficits that are noted in flaccid dysarthria, we are here today to model some of the most useful behavioral treatment modifications. So let's get started. First and foremost, hypernasality is one of the most commonly noted deficits noted in this disorder, and the most prominent speech characteristic. One very helpful treatment approach could be utilizing an open mouth position when speaking. This includes an exaggerated jaw movement of the patient, which can be very easily implemented just by making them more aware. So I'm going to have Shelby help us out here. First of all, you want to make your patient more aware of their hypernasal speech. See if they can note that they hear that nasality sound. Compare it with your own speech. Another technique you can utilize in therapy is to use a mirror. For the purposes of this video, we're going to use our playback feed that we can see ourselves on the camera. So you can have your client look in a mirror, and while you are speaking, to watch your exaggerated lip and jaw movements. Shelby, tell them what your name is.
My name is Shelby.
Good. Now there's a way that you can compare and contrast with your client. Have them say this while looking in a mirror with the very closed mouth posture, and you can immediately hear more hypernasal speech, as if, or instead of, if you were to use the open mouth posture. This is very easy for them to note themselves. Please say, "My name is Shelby," with the closed mouth and the open mouth, and note the difference.
My name is Shelby.
Open mouth.
My name is Shelby.
Very good. Another area of deficit that is noted within flaccid dysarthria lies within phonation, resulting in a breathy or harsh vocal quality. Pushing and pulling maneuvers are an effective method for increasing muscle contractions in the torso and the neck that have been affected by that muscle weakness we mentioned earlier. So that pushing and pulling maneuver, if your client is sitting in a chair that has rests, you can ask them to hold onto the armrests and pull up, or have them push down on any surface that they are surrounded, whether that be the floor if they're on the ground, or a table. So as they sit up straight, push down and hold themselves up, and have them phonate an open vowel. So as you push down, say "ah" for me, hold it open.
Ah.
Very good. That will help the musculature. The next symptom that you are likely to see in flaccid dysarthria is a prosodic deficit, specifically noting problems with intonation, stress, and rhythm. Pitch range exercises can be useful when targeting intonation especially. So when you do these pitch range exercises, first you want to make sure that your client can note pitch changes within your voice itself. Present them with a low sound and a high sound, so ah, and go back and forth and see if you went higher and lower. Next, you will have them prolong ah at the lowest pitch and then at the highest. Shelby, prolong ah at the lowest pitch possible.
Ah.
Very good. Now, can you give me the highest pitch?
Ah.
Very nice. Now that you've established that low pitch and that high pitch, please sing up and down that scale. Let's go up. So ah.
Ah.
Wonderful. Due to weakness in reduced range of lip motion, articulation deficits are also highly noted in flaccid dysarthria patients, specifically with bilabial and labiodental phonemes due to the weakened musculature of the lips, as well as weakness in reduced tongue motion or range of motion. The client is able to produce these phonemes, however, the muscle weakness is a limiting factor for them. So over-articulation is another method that is extremely useful in implementing in therapy. So what we want to do is over-articulate consonants and make sure that they focus on the medial and the final consonants of the words that they are saying. Really be dramatic and over-exaggerate their speech. So I would say, my name is Brenna. Really focusing on every consonant that you come across. And yours?
My name is Shelby.
Very good. And finally, the last behavioral treatment approach I would like to discuss is aimed at improving respiratory weakness. As I mentioned earlier, flaccid dysarthria is commonly represented by poor breath support due to the weakened muscles. That weakness makes all aspects of speech extremely difficult for your patient, so this is something that's very important for you to address in therapy. One particular procedure to assist these deficits is speaking immediately on exhalation. People with flaccid dysarthria often have a habit of inhaling, beginning to exhale, and after a little bit of exhalation, then they start to speak. So what you want to do is implement in therapy, get them more aware of breathe in, and as soon as they breathe out, they should start to speak directly on that exhalation of air. One method that you can use for this is to have them hold their hand over their stomach, feel as they breathe in, as the stomach expands, and as they breathe out, do you feel your stomach compress and go back down? Good. So what I want you to do next time, breathe in, and when you breathe out, the second you feel your stomach go back down, prolong an sound. Don't let any air escape before you prolong that sound. Very good. So you want to make sure that they phonate the second that they begin exhaling their air. Thank you very much. These are some great tips for you to use on flaccid dysarthria patients in therapy, and I hope they were helpful.